Mid-upper back pain is primarily a postural issue that people create themselves. Our bodies are built to move, not to stand still or sit at a computer for a long time. The more you stay still, the more important posture becomes, because you have to statically deal with the constant vertical load of gravity. Most people develop a strategy for how they sit and stand from a very young age, and then almost never think about it after that. Some people opt for a full-body lazy slouch, while others opt to subconsciously brace everything in their body. Mid-back pain usually arises from one or the other. Those that learn the skill of sitting and standing properly in a relaxed state tend to have very little pain. The first thing you need to understand is that your shoulder muscles should not be used to try and hold your torso up. In a resting state, your arms should be passively hanging at your sides, not being constantly pulled back. Overuse of the shoulder retractors is the leading cause of mid-upper back pain, and unfortunately that is the exact exercise that most people are taught to do when their mid-back hurts. Your rhomboids attach from your shoulder blades to your spine, and if they are constantly tugging, your mid-back can get sore. People get concerned when their shoulders are rounded forward, and typically then attempt to squeeze them back, hoping this will change something. Well, sorry to tell you, but it probably won't. Your shoulder girdle sits on the upper quadrant of your rib cage and is only attached by a bony joint where your collarbone meets your sternum. The rest of it's all muscles. There are muscles that pull the girdle up, down, back, and forward. It is the balance of these muscles, combined with the roundedness or flatness of your rib cage and upper back, that will dictate where your shoulders sit. They are two separate things, but the position of your spine and rib cage trumps the position of your shoulders when it comes to what to try and correct. If you just try to pull your shoulders back, you will not get anywhere, especially if your upper back is quite rounded, because when it is rounded, your shoulders should sit forward, and overly pulling them back will just further limit your shoulder flexibility. Your thoracic spine extends from the base of your neck all the way down to the top of your low back, and is supposed to have a gentle rounded curve the whole way. The upper part of your back is relatively a lot stiffer than the lower part, due primarily to your rib cage. Your ribs are like a big ring of bone that attaches into the side of your spine and wrap around to attach on your sternum in the center of your chest. These ribs need to be stiff yet mobile to protect your organs, but also allow you to breathe and move. Postural issues that allow the trunk to get overly rounded or overly braced and straight restrict your ability to breathe fully, rotate your trunk, and elevate your shoulder properly. This area is the trickiest part of your body to properly correct your posture due to the relative tension difference and poor awareness of your head position. Your brain has a head-righting reflex that wants to keep your head looking straight forward, but it will accomplish this in the easiest way possible by giving in to the relative tightnesses in your body. Most people tend to develop a bit of a head-forward position due to some roundedness in their upper back. Because the upper back is a lot stiffer than the mid and lower back, the tendency is to overly extend the lower part of the trunk and sway the hips forward to accommodate the neck and head. Unfortunately, this practice puts your head in a happy, easy position at the cost of the rest of your body, and over time will lead to further roundedness in the upper back, more head-forward posture, and a lot of compression in your lower back and ribs. Your diaphragm is a commonly ignored and misused core postural muscle. It sits inside the bottom of your rib cage all the way around. It helps you breathe and should help support your trunk upwards. We tend to overuse the outer bracing muscles and underuse the inner supportive diaphragm, which leads to a lot of downward compression in our spine and ultimately degeneration and pain. Learning how to use the back half of your diaphragm can help restore the position of your lower trunk and lift a lot of weight off of your lower back. The goal of good posture is to vertically elongate the body, and we tend to misinterpret this with leaning backwards. The diaphragm is the missing link to help you stand and move more efficiently.